Welcome to the EOE Patient Resources Podcast, where we dive deep into everything you need to know about eosinophilic esophagitis. I'm Andrei, and I'm not just your host. I'm someone who's been living with EOE and understands firsthand the confusion, frustration, and questions that come with this diagnosis.
And I'm Sarah. It's great to be here. I'm really looking forward to, breaking down some of the medical stuff about EOE into information that's actually useful for patients and families. Andrei, you've lived this. What was maybe the biggest thing you just couldn't find clear answers on that made you think, we need something like this?
It's funny. The medical facts were sort of there after diagnosis, but what it actually meant for my day-to-day life, for the future, those answers felt, well, they just weren't easy to get in a quick doctor's visit. It just became so clear that people needed a more comprehensive resource, a real deep dive, like you said, into what living with EOE is actually like. So if you're listening right now, maybe you're newly diagnosed, maybe you're still trying to figure out what's causing your symptoms, the absolute first thing to know is you are really truly not alone in this.
Absolutely. And the numbers really back that up, don't they? EOE isn't some super rare thing anymore. We now think it affects roughly 1 in every 700 people here in the U.S. That's a big deal because not long ago, the estimate was more like 1 in 2,000. So this jump reflects, well, partly doctors recognizing it better, but also it seems like there's a genuine increase in cases happening. That changes things for people seeking diagnosis.
Yeah, my own story kind of highlights that diagnostic challenge. I mean, I had symptoms for quite a while before I got the actual EOE diagnosis. And reading up on it, it seems that's incredibly common. The average time from when symptoms start to actually getting diagnosed can be several years for some people. It just really shows you need to keep pushing for answers if something feels wrong.
It's complex, and what's really interesting is that EOE itself wasn't even really recognized as its own distinct condition until the early 1990s. So we're still learning a lot. But the positive side is awareness now is so much better. And that's led to much better ways to diagnose it and, importantly, better treatments than we had before. So let's start with the basics. What is EOE? Fundamentally, it's a chronic condition driven by the immune system. It's basically an allergic inflammatory disorder, and it specifically targets the esophagus, that tube connecting your mouth to your stomach. Your immune system mistakenly flags things, usually foods, but sometimes environmental stuff like pollen as threats when they really aren't.
Yeah, for me, it was definitely food-related. It honestly felt like my immune system just decided certain foods were the enemy.
Exactly. And what happens then, the mechanism, is that your immune system sends these specific white blood cells, called eosinophils, rushing to your esophagus. They build up there in really large numbers where they don't normally belong, and they release these inflammatory proteins. That's what causes the swelling, the inflammation, and eventually the damage to the tissue.
Right. And that's the danger if it goes untreated, isn't it? That chronic inflammation doesn't just hurt. It can actually change the esophagus over time. It can cause scar tissue to form, which leads to narrowing. They call that strictures. And in really severe cases, people might end up barely able to eat solid foods because of all the scarring. That's kind of the scary potential outcome.
And another really important piece of the puzzle is that EOE often doesn't happen in isolation. Many people with EOE also deal with other allergic conditions, things like asthma, allergic rhinitis, which is hay fever, eczema, or other food allergies. We sometimes talk about this pattern as the atopic march, this tendency for allergic conditions to cluster together.
That makes sense. It kind of explains why treating the EOE sometimes helps other allergy symptoms too. And the common food triggers, the big ones you hear about, are things like dairy, eggs, wheat, soy, nuts, seafood. And this is key, it's so individual. My list is way longer than that. Dairy is huge for me, but also chicken, shrimp, soy, certain oils, tomatoes, even hummus. It varies a lot person to person.
So true. Okay, so we know what it is biologically. Now, how does it actually feel? What are the symptoms people experience? Because they can be really different for everyone and sometimes kind of sneaky. They often develop gradually, and people can unconsciously start changing how they eat to cope without even realizing it's because of a medical issue.
Oh, absolutely. I look back now and see all these little tricks I developed. Chewing forever, taking tiny bites. I just thought that was my normal way of eating. Sure. It's amazing how you adapt without knowing why.
Exactly. So in adults, the classic symptoms are often difficulty swallowing. The medical term is dysphagia. Food feels like it's going down slowly, or maybe it feels like it's getting stuck partway. And then there's food impaction. That's when food gets completely stuck, and it's often a medical emergency. But besides those big ones, there are those subtle coping things you mentioned. chewing way more than usual, cutting food super small, eating really slowly, needing tons of water with meals, maybe avoiding certain textures like dry meats or breads, or even shying away from eating in social settings.
Yeah, difficulty swallowing was definitely my main thing. That feeling of food just inching down or getting stuck. I
Yeah.
also had a lot of coughing while eating and this weird chest pain sometimes. It made meals pretty stressful.
Right. And other common symptoms in adults can include that chest pain, often right in the center, and confusingly, it doesn't get better with antacids. Or heartburn that doesn't respond to the usual acid reducers. Some people also experience regurgitation, bringing undigested food back up.
And it's interesting, something I learned looking into this is how different it can look in kids. For babies and toddlers, it might show up as feeding problems, maybe poor weight gain, what doctors call failure to thrive, or lots of vomiting, spitting up, maybe arching their back like they're in pain, sometimes even just refusing food altogether.
Yeah, and in older kids, it might look like a poor appetite, or they get full really fast, maybe complaining of stomach aches or nausea. They might have trouble swallowing too, or have reflux symptoms that just don't clear up with standard medication. It's often mistaken by parents as just being a picky eater, when really the child might be avoiding foods because they cause discomfort.
And another thing that makes it tricky is that symptoms can flare up and then seem to get better for a while. That on-again, off-again pattern can make it really hard to recognize initially because you might have periods where eating feels okay.
Absolutely. That variability makes the diagnostic journey, well, sometimes quite long and frustrating. Especially because, as we mentioned, the symptoms can really mimic other things, particularly GERD. That overlap is a major reason why diagnosis gets delayed. People might spend months, even years, trying treatments for acid reflux before EOE is even considered and tested for properly.
I actually got lucky in that sense. My gastroenterologist was really knowledgeable. As soon as I described my symptoms, EOE was high on his list, and he ordered the endoscopy pretty quickly. It really showed me how important finding the right doctor is.
That's great to hear. And it does show how much awareness has improved among specialists. Because a diagnosis absolutely requires that upper endoscopy. They use a thin, flexible tube with a camera to look directly at your esophagus. And critically, during that procedure, they have to take multiple biopsies, tiny tissue samples from different parts of the esophagus. You just can't diagnose EOE based on symptoms alone. Those biopsies are essential.
Yeah, the endoscopy itself wasn't bad. I was sedated, didn't feel anything, and it was over in maybe 20 minutes or so. During the scope, the doctor might see signs like white patches, maybe rings or ridges, sometimes furrows down the esophagus, or what they call a crepe paper look, where the tissue looks really fragile.
But those visual signs aren't enough for diagnosis. The confirmation comes from looking at those biopsy samples under a microscope. The pathologist counts the eosinophils in a specific area called a high-power field. If they find 15 or more eosinophils per high-power field, and you have symptoms consistent with EOE, that's the definitive diagnosis. Okay, so you have the diagnosis, now what? It's really important. EOE isn't curable, unfortunately, but it is very manageable. It's a lifelong condition, yes, so it needs ongoing management. But the good news is the treatment options have really expanded. We now have several effective ways to control it long term, including the first ever FDA-approved medication specifically for EOE, which is huge.
Right, let's talk about those treatments. Often, one of the first things doctors try is proton pump inhibitors, or PPIs, like the ones used for acid reflux. Now, this is interesting because EOE isn't caused by acid, but PPIs often work anyway. They seem to have some anti-inflammatory effect in the esophagus for people with EOE. That was actually the first thing I tried.
Exactly. Another common first-line approach is topical corticosteroids. These aren't pills you swallow whole. They're medications like fluticasone, often from an inhaler used without the spacer, or budesonide made into a slurry. The idea is you swallow them, they coat the esophagus directly, and reduce the inflammation right there at the source.
Okay, and then there's the really big news in EOE treatment, something I'm actually on now.
Yeah.
That's dupilumab. The brand name is Dupixent. It got FDA approval for EOE in adults and teens back in May 2022, and then just this year, January 2024, for kids aged 1 year and up over a certain weight. For me, this has been the treatment that's really made a difference.
Dupilumab is what we call a biologic medication. What makes it a game changer is that it doesn't just mask symptoms, it targets the specific underlying inflammatory pathway that drives EOE. It's given as an injection, usually every 2 weeks, that patients can learn to do themselves. It's been particularly helpful for people who didn't get good results from PPIs or steroids, or those who have multiple allergic conditions along with EOE.
Then there's dietary therapy. This is a major approach, but it takes a lot of work. The most common is the 6-food elimination diet. You basically remove the top 6 allergy triggers, dairy, eggs, wheat, soy, nuts, and seafood completely for about 8 weeks. Then you have another endoscopy to see if the inflammation went down. I actually did this diet very strictly, but it turned out I have too many triggers for it to be practical long-term for me. My safe list ended up being things like salmon, beef, lamb, rice, broccoli, potato, sourdough bread, banana, mango. Identifying those was key.
Right. And if the elimination works, the next step is reintroducing foods one by one, slowly. Usually one food group every 6 weeks or so, followed by another endoscopy to see if that specific food brought the eosinophils back. It's definitely time-consuming and involves multiple scopes, but it can be incredibly valuable for pinpointing your specific triggers and hopefully expanding your diet again.
And for people with really severe symptoms or maybe tons of food triggers, there's also something called the elemental diet. That means you get all your nutrition from special liquid formulas for a while. It's extremely effective because it removes all potential food protein triggers, but it's also very, very restrictive and hard to stick with. So yeah, my path involved trying the PPIs, doing the elimination diet, and now finding success with Dupixent. I've had 4 injections so far, and I'm already noticing, subtle improvements. Still avoiding my triggers, especially dairy, that's my biggest one, but feeling hopeful.
That's great progress. Now, sometimes, even with medication or diet, if EOE has already caused structural changes, like strictures that narrowing from scar tissue, another procedure might be needed. That's esophageal dilation. This is where the gastroenterologist gently stretches the narrowed parts of the esophagus during an endoscopy to make swallowing easier.
Yeah, this is one where you definitely want someone experienced doing it. That esophageal tissue in EOE can be really fragile, like we mentioned that crepe paper esophagus idea. But when it's done carefully by someone who knows what they're doing, it's generally safe and can provide pretty immediate relief from that stuck feeling.
So when we think about treating EOE today, we really have 4 main goals. First, obviously, symptom relief, making eating comfortable again. Second, what we call histologic remission, getting those eosinophil counts in the biopsies back down to normal. Third, preventing long-term complications like those strictures. And fourth, just improving overall quality of life.
And ideally, your treatment plan, like mine now with Dupixent, aims to hit all those targets. But it really drives home the point that treatment is so personal. What works wonders for me might not be the right fit for someone else. PPIs might be perfect for one person, diet therapy for another.
Absolutely, which is why having that ongoing relationship with a knowledgeable gastroenterologist is key. They can help you navigate the options and adjust the plan as needed over time. Okay, let's shift gears a bit and talk about practical strategies for just living with EOE day to day. Beyond the medical treatments, what helps?
Oh yeah, there are definitely things you learn. Eating strategies become second nature. Taking smaller bites. Chewing really, really well. Eating more slowly. Trying not to be distracted during meals. Always having water nearby is crucial. And of course, knowing your triggers and avoiding them. I've become pretty good at mindful eating now, and reading ingredient labels is like a superpower you develop.
Emergency preparedness is another big one. You need to know the signs of a food impaction when food is truly stuck, maybe causing chest pain, you can't even swallow your own saliva. Have a plan for how to get to an ER quickly if that happens. Some people find it helpful to carry a little wallet card explaining they have EOE, just in case.
Social situations. Yeah, that can be tricky at first. Researching restaurants ahead of time, maybe calling them about ingredients. Sometimes bringing your own safe food to gatherings is the easiest option. I've found most people are actually really understanding once you explain why you're being careful.
And we shouldn't forget the emotional side. It's totally normal to feel anxious about eating sometimes or frustrated by dietary limits, maybe feel a bit isolated when everyone else is eating freely.
Definitely. Connecting with other people who get it through EOE support groups or online communities, that's been huge for me. Just sharing tips and knowing you're not alone makes a world of difference. And for parents, help your child understand their EOE in a way that makes sense for their age. Try to keep family meal times as normal as possible so EOE doesn't completely take over their relationship with food.
Good advice. And coordinating with their school about dietary needs, connecting with other families facing the same challenges, those are really helpful steps too.
One simple thing that really helps, especially early on, is keeping a food and symptom diary. Just tracking what you eat, when, and how you feel afterwards can uncover patterns and really help guide treatment adjustments with your doctor. It gives you some control back.
It really does. And despite the challenges, there's genuinely so much reason for hope in the EOE world right now. The field is moving incredibly fast. We have better research, better diagnostic tools, more treatment options than ever before. That FDA approval for Dupixent, that was a massive step forward.
It's amazing how much things have improved even just since I was diagnosed a few years ago. The long-term outlook now is really positive for most people. With the right management, you can get significant symptom relief, prevent those serious complications, and for kids, maintain totally normal growth and development.
The key really is that ongoing management piece. Staying connected with your healthcare team is vital.
Exactly. It becomes less of a crisis and more of a routine,
Yeah.
Regular check-ins with the gastroenterologist, maybe scopes every so often to monitor things. It becomes part of life, not the whole focus.
And the research continues. Scientists are working on new medications, even better diagnostic methods, and trying to understand more about the root causes, the genetics, the environmental factors. There are several promising new treatments in the pipeline right now. Okay, let's tackle a few common questions we hear a lot. First big one. Will people with EOE ever be able to eat normally again?
That's the million-dollar question, right? The good news is many people with well-controlled EOE can get back to eating most of the foods they enjoy. The goal of treatment isn't necessarily zero restrictions forever. It's maximizing dietary freedom while keeping that inflammation under control. Some people might always need to avoid a few specific known triggers. But the idea of needing severe, lifelong dietary restrictions isn't the reality for many anymore, thanks to effective treatments. My goal absolutely is to eat almost everything again, just carefully avoiding my known problem foods.
That's encouraging. Next question. Is EOE genetic? There definitely seems to be a genetic component. EOE does tend to run in families, and it's linked with that tendency towards other allergic conditions we talked about. But it's not a guarantee having the genes increases your risk, but doesn't mean you'll automatically develop it.
Okay, how about this one? Can children outgrow EOE? Generally, EOE is considered a lifelong condition. The underlying immune response doesn't just disappear. However, kids can achieve really excellent control with treatment. It's possible some might need less intensive management as they get older, but they'll likely still need some form of ongoing monitoring into adulthood. It doesn't just vanish.
Right. And finally, are there any foods that are universally safe for everyone with EOE? Unfortunately, no. While we know the common trigger is dairy, wheat, eggs, soy nuts, seafood, what actually causes a reaction varies hugely from person to person. There's no single food that's guaranteed to be safe for everyone with EOE.
So if people want to learn more or connect with others, online communities, Facebook groups, forums, they can be fantastic for that day-to-day support and sharing practical tips. Just talking to people who understand the little details is so helpful.
And in terms of healthcare, finding a gastroenterologist or a pediatric gastroenterologist for kids who really specializes in or has a lot of experience with EOE is important. Some hospitals even have dedicated eosinophilic disorder centers. Consulting with an allergist, especially one familiar with food allergies and EOE, can also be really beneficial as part of your care team.
And just generally, staying informed helps. Following reputable organizations like APFE or Cured, maybe subscribing to research updates, attending patient education events if you can, and keeping that communication open with your own doctors about what's new.
Great advice. So as we wrap up this deep dive, Andrei, what's the final thought you want to leave our listeners with?
I think if you're newly diagnosed or maybe still trying to get diagnosed, it can feel really overwhelming at first. I know it did for me, but I want you to know you're on a path now, a path toward understanding what's going on and getting effective help. EOE is treatable. It's manageable. You absolutely can live a full, active, happy life with it. Don't let it define you.
That's such an important message. And the truth is, the options we have today are far better than they were even just a few years ago. Our understanding is growing so fast. This really empowers you, the patient, to take control, work with your doctors, and get back to enjoying food and enjoying life.
Exactly. It's about reclaiming that quality of life, that relationship with food. It might take some work, some adjustments, but the path forward is much clearer now than it used to be.
Couldn't agree more. With the right healthcare team supporting you, the right treatment plan for you, and good information, you can definitely move forward with confidence and a lot of hope. And just a reminder, of course, that everything we've discussed today is general information. It's not a substitute for professional medical advice. Always talk to your own doctor or healthcare provider about your specific situation.
Absolutely. And remember, truly, you are not alone on this journey. There's a strong community out there and healthcare providers who really care and specialize in helping people with EOE.
This has been The Deep Dive.
Until next time, take care of yourselves and remember, you can thrive with EOE.
And here's something to think about. Consider how your personal journey with EOE, including advocating for your needs, like asking restaurants for allergen transparency, can not only improve your life, but also contribute to broader awareness and better support systems for the entire EOE community.